All right, we are back with another episode of Claims Denied, a hospitology podcast. Today, we are taking a deep dive into the oncology space with two pros that have been walking the walk in that space for quite some time, Ben Freeberg and Dan Nardi at Reimagine Care and Oncology Ventures, respectively. Ben, Dan, how are you guys doing today? What's going on?
Doing great, Blake. Thank you very much for having us.
All is good.
Yeah, super excited to have you guys as well. And thank you again for your time. Would love to just take this from the top and, hear you guys' stories in healthcare, what got you into healthcare and then oncology, and we can kind of go from there. And so, Ben, why don't we start with you and go over to Dan next?
Sounds great. So it's good to meet everyone. And I launched Oncology Ventures a little over 3 years ago. Started my career in banking, a little bit of venture capital. And then I was diagnosed with cancer now coming up on 8 years ago. And after that experience, realized how much is broken outside of just the drug side of the oncology world, and thought there was a huge opportunity to better improve care inside and outside the walls of a hospital through better use of data, IT, and better systems. And so that's what led me on this journey, backed by an incredible group of strategic limited partners. And by the time this comes out, we will have formally announced our fund too. So excited to double the scale here and continuing to invest into companies improving cancer care and research. And we don't take any regulatory approval risk. So all of our portfolio is commercializable today. And so it allows us to bring folks like Dan and the Reimagine Care team, which is one of our incredible portfolio companies, to our strategic limited partners and say, hey, this is already proven ROI, proven outcomes. You want to improve care, reduce costs. Here's our suite of services to help do so.
Awesome. Thanks, Ben. And real quick, Dan, before you go, I want to give a quick plug for Ben's newsletter, because you kind of write that alongside your investment,
Yes.
Which is very cool. I went to your website and I see you have your kind of thesis under each one of your portcos, which is very cool. Great structure. Do you want to kind of give a quick shout out to what you do there?
Yes, my one plug for after this is if everyone could go and subscribe to Oncology Ventures Substack. Once a month, we send out an email that has the first half is an overview on the oncology market, either what we are seeing, learning in the space, and or a deep dive into the rationale behind one of our investments. And so one of our theses for the fund is I want to make cancer easier to talk about. And I also don't understand why a lot of venture funds don't publicly share their investment theses in certain spaces. So if we could educate the market and help explain to folks why we are making certain investments, that's huge. And then the back half is always a stand-up comedy bit. So have some fun with it. More people respond to the comedy side than the cancer side, but it gets people to read to the end. So it's been a lot of fun to write.
Yeah, that's funny. Because I'll do something similar with my newsletter, write about golf for my 2-year-old or whatever, and more people will respond to that. So it's a very personal touch and very cool. So that's awesome, Ben. And Dan, why don't you go ahead next? We'd love to hear your story.
Yeah, of course. And I'll second that plug for Ben's newsletter. It is a great one. And I think it's a really great way to kind of connect, the fund and their approach out to the public. And then the humor is always a welcome addition on the end. So it's great. But Blake, thanks for having me. I don't know, I've been in healthcare for long enough to not have hair. And now on my third startup. And I realized that early in my career that I loved the building phase of companies like this, taking really amazing ideas that are helping people at the point of the care delivery and then and setting them up for scale. And so, I had a good run at Livongo and then also at Carum. And now I've been CEO of Reimagine Care for the past 3 years. Which has been a really exciting ride. And similar to kind of Ben in starting his fund, I mean, I was first presented the opportunity to join Reimagine Care, take over the reins. And, every conversation I had with the board and the team, I realized how impactful and how well set up this company was to be able to drive outcomes and really improve the patient experience. And so that's what sold me on that. And as we all continue to get older, more and more of us are impacted by cancer. Some of us ourselves, and some, certainly with close friends and family and loved ones. So it was an opportunity for me to help make a difference in that area. So that's why I'm here.
Yeah, it's awesome. And it sounds like just a lot of folks who are in healthcare, but you guys specifically, have very personal experiences with, the oncology and cancer care. So really, humbled to be talking to folks very close to that space. And as such, you guys live and breathe it every day. And then maybe we can start with you, just being kind of an investor, more 10,000 foot view kind of thing. Would love to hear, what how do you see kind of the current state of oncology, maybe what's shifted over the past 12 or 24 months? Where are you playing, et cetera? Seems like there's something new every day. So would love your perspective on that.
Yes. So we're at a point now, which I think some of these stats have shocked people, is roughly 1,700 people die a day of cancer in the US. And what we've now seen and learned from research over the past few years is that 1,000 of those deaths are preventable. So that's more than 50%. And that is preventable through care treatment data we already have. So this is not next new moonshot, next new type of CAR T therapy or whatever else. It's how do we detect cancer earlier? Yes, of course, huge opportunity for preventative care. People shouldn't be using tanning beds. People shouldn't be smoking cigarettes, all of that. But there's also a lot of how do we diagnose cancer earlier? How do we help folks get top level care outside of the hospital? This is one of the cornerstones behind why we were so excited to invest into Dan and the Reimagine Care team. Is most of that care is not sitting in the infusion chair. It's what happens in between appointments. And I think the understanding and appreciation for the impact that could have in improving outcomes and reducing costs has been stronger than ever. And so we invest, the second part of the answer is we invest into, I would call it 3 different types of companies. One is data-driven care delivery and services. How do we help folks take action on early detection, on that care navigation support through to survivorship care? Bucket 2 is how do we help physicians and administrators do their jobs better? And so a lot of that is enterprise SaaS types tools to help. We invested into a company improving prior authorization for oncology. And for anyone who's experienced that part of the healthcare system, incredibly inefficient on both sides. So how do we help give them the tools and resources to more effectively do their jobs and spend more time caring for and treating patients? Then the third bucket is what we call like the pick and shovel approach to drug development. So people who made money during the gold rush weren't necessarily the people finding the gold. It was people selling the picks and the shovels to those miners. And so how do we invest into those tools to get drugs to market faster, to improve clinical trial access and matching, et cetera? And so I guess to summarize the answer to your question of what's changed is I think people's appreciation for all of that. I think people are now excited to and looking for ways to spend money on these tools and platforms that otherwise I don't think there was really a budget. I also think there's an appreciation for cancer being different and unique. You can't just use a diabetes tool to improve cancer care. And Dan could talk a lot about the different forms and different disease states and what that tech requires. But I would say it's all that appreciation. And a big part is because costs are breaking, right? I mean, it's the 4th year in a row. Cancer is employers' top driver of healthcare costs. It's growing at 3x the rate of other disease states. We're over $220 billion in spend, and it's all preventable. So that's where we're seeing the market and where we think there's an opportunity for us to invest.
Yeah, and that's fascinating. And just a kind of a bolt-on question to clarify, like you don't play in kind of therapeutics at all. Like you're solely kind of the infrastructure side. Is that correct?
Yes, data, infrastructure, services, anything behind touching the patient provider today.
Yeah, that sounds great. And to your point, that's very sobering to hear that a lot of cancer diagnoses in America are not the diagnosis, but the treatment is you can prevent if you find it sooner and those sorts of things. It sounds like par for the course in healthcare where we're investing in all the flashy stuff, and that's all great too, right? Like the therapeutics and everything, but the actual processes are broken as well. And very cool for you to be playing there too.
Yes, appreciate that. And I'll also just say, like, we're so pro and for all of the work being done to improve new unique types of drugs. It's just not my lane and not where we have a differentiatedly supportive strategy. So,
absolutely. No, I appreciate that clarification. And now I would love to pivot over to kind of, Reimagine Care. And Ben, what attracted you to them, for you to invest in them? What were kind of key characteristics of Dan and co? And maybe we can dive in there.
So one, we'll start with team, because I would say this is probably the top reason why companies drop off of our diligence process is not being able to do what I think Dan explained so well, is understanding what the business model is today, and after you scale, attribute ROI, et cetera, how that business model changes over time. So I think Dan and the Reimagine Care team had and have such a clear understanding of how they could fit in today. You're a hospital system, you're a cancer center, you need to better manage your cancer patients outside the four walls. There's no one that's doing that perfectly today. Here's how Reimagine Care fits in. Now, after Reimagine Care has all of the engagement, support internally, continues to scale and grow, that business model and the impact they have can continue to grow with it. So I think big bucket one was the understanding of that piece. Part two was, it's a huge gap in the market. I think a lot of people overemphasize certain parts of the cancer journey, but this idea, when I was going through my treatment, I was neutropenic for a lot of my treatment, which meant I didn't have enough white blood cells to fight off infection. And I would call them, I was dehydrated, I had a headache, and I would call my cancer center and they'd say, why don't you come into the emergency room? That was the default, was going into a room with other sick, immunocompromised people that I had to take a cab 30 minutes, like the cost, time, effort, risk of infection. A lot of those ED visits could have been avoided if we had what Reimagine Care has, and we could talk about Remy and all of the other incredible products that Dan is better place to speak to. But I just saw it firsthand, the amount it would have improved my experience, reduced complications and reduced costs actually for everyone involved. So that was the big second bucket. Then the third bucket is just very candidly how do companies grow? I think there was this steadfast goal always from the launch of Reimagine Care of improving care outside the four walls, but they went out and learned, and they weren't doing this with blinders on. I mean, they were probably one of the more that we've seen in the space collaborative with their strategic partners and understanding where it should or shouldn't be, implemented. Where do you take over? Where do you partner? Where do you build together? And so I think that understanding too, of being really clear on your go-to-market and the opportunity, but also listening along the way to customers, I think was a really unique balance.
Yeah, that's super helpful context. And Dan, would love to hear it from the horse's mouth too, as well. And tee up the conversation for listeners who might not be as aware of, Reimagine Care, Oncology, and so forth. Can you give me just like a brief history of Reimagine Care and, assess the current state of the company and, future growth and everything in between?
Yeah, how much time we got? Because we could spend a lot now. Yeah, appreciate that. And I'll come back to some of the points that Ben made, because I think it's really important. And a lot of what he was saying is the reason we exist. But let's start with a brief history. So the company is 5 years old. It started in COVID times in late 2020, and it was for a similar reason to what Ben just outlined. So our founder, Devin Carty, who runs Martin Ventures and is a friend of this group here and others, he had a very close friend of his was diagnosed with late stage colorectal cancer. And so he was there with his friend going through the treatments. And unfortunately, his friend passed away, but not because of cancer. It was because he contracted an infection going into the clinic for a follow-up, something that could have been done remotely. And so the original thought that Devin had was like, hey, we can be better at this. How do we help bring care to the patients? And the original thought was maybe for a subset of patients, we could even bring chemotherapy, bring the treatment to the home. And so that was really what it started, which was a really noble idea. And I think, at some point we're starting to see it a little bit in certain windows, certain geographies here. But, as the company was getting up and running, it's hard as a startup to make that your only revenue stream. There's a lot of regulatory and reimbursement hurdles. And so we started to adjust and pivot. And around that time is when I joined the business. And what we had realized is that there was a core part of what the company was building that really has turned into what we have now. And that's the AI-based virtual assistant, Remy, that is there connecting with patients proactively, reactively, filling that gap, the 97% of the cancer journey that happens outside the clinic, just like Ben was saying. And so right now, we as a delivery system haven't spent a lot of time in innovating in that area. Innovation in cancer care has been spent on the new therapies, the new treatment plans, right? Finding a cure. All of that is so, so important. But we also have the opportunity to focus innovation into the delivery of care. And that's where, we started to move into with Remy, and then backstopping it with a remote team of oncology trained MAs, RNs, APPs, and collectively, we built a virtual cancer center. And so that's what we have today. That's what we've been now live with for 3 years, supported tens of thousands of patients, 250,000 patient interactions with Remy and our care team, and have driven some really impressive outcomes that we can talk about later. But that's really kind of what's gotten us to this point. And I guess the last kind of part of that is we partner with oncology clinics, so independent practices, to large health systems, community health systems and hospitals, to even the large comprehensive cancer centers like Moffitt and City of Hope, Memorial Hermann, Tampa General, CCBD, and others. And so there's value that we're able to bring in partnering with these oncology practices of all shapes and sizes. So that's a little bit about the history, and we can kind of jump in from there.
For sure. Yeah, and it's super helpful. An awesome journey. I can imagine you have quite the trajectory starting during COVID and then now in 2026 that I'm shooting. We can get into if we have time for it, but more interesting to me is would love for you to dive further into like what is that value you provide? Because I know there's a white labeling part of this, and maybe you alluded to Remy, which is a pretty new announcement from you guys on the AI front. So maybe you could walk through like, hey, I'm a health system, I'm Tampa General or whoever. This is my current state of operations. Here are my pain points, and this is how Reimagine addresses those and supercharges oncology care for patients.
Well, I think the current pain points across all of healthcare right now are we have a growing divide in the supply and demand, right? We have more patients, more health consumers, right? If you think about it that way, than ever before. And especially in oncology care, we just eclipsed the 2 million newly diagnosed patients for the first time last year, and it's only expected to grow. But then on the supply side, we have burnout. Where nurses and APPs and oncologists they're burnt out, right? They're being asked, so much is being asked of them. And so they're leaving the workforce. They're wanting to go work for startups. They still want to support patients, but they're burnt out of being in clinic. And so, you have this, the divide, like I said. And so what our goal is to bring technology and a remote team that is able to help fill that gap. And because you're not going to be able to keep throwing bodies at it, which has been the healthcare's response for decades. Let's hire more people. And so we can't do that anymore. We're well past that. And so when we're filling that gap, we've built very structured programs with Remy where we're doing proactive check-ins throughout the week in between those visits. So if you've got a weekly chemotherapy visit, like what happens in between? Well, the standard of care right now is, you're 4 days after your infusion and you notice some swelling or a redness, you're going to call into the clinic. Well, if it happens after 5 o'clock, good luck getting an answer, right? I mean, the average response time right now, average resolution time, not even response time, average resolution time is 24 to 48 hours. Like, think about that, right? These are highly high acuity patients that need support within minutes, not days. And so what we've been able to do with Remy, and this is part of the outcomes, Blake, that we've been able to show is, we're able to drop that down to 30 to 60 minutes for resolution times because instead of having to call, leave a voicemail, wait for it to be triaged, and then you're going to resort to Dr. Google and you're going to freak out by what you find out and you're going to go to the ED anyways. Well, instead of that, as your kind of default, you send a message to Remy. Text message, right? That's what we use. There's no apps, no portals, no passwords to forget, all that other stuff. You can just send a simple text message and Remy's responding within seconds, right? Remy doesn't need to take, breaks. It doesn't take vacations. It's just constantly there. And it's massively scalable, which is like the important part here. But even more importantly is that Remy is able to resolve about half of the interactions it handles every single day. So
that's awesome.
52% of all the interactions, the questions, symptoms, issues, Remy is able to resolve itself. Now, the ones that it can't, it passes off within minutes to a remote team, who are then, the average response time now from when you initiate with Remy, and which will take, 5, 6, 8 minutes going through some of the initial triage. Well, from that initial point of texting Remy to when you get a human on the line, if you need it, is 12 minutes or less now. So think about that and that contrast, right? So we're able to take it over and then we can escalate it up. And this is 24/7. So 2 a.m, 5 o'clock on Friday, like the traditional gaps in our healthcare delivery system, this becomes really impactful. So we can catch patients when they're 4 or 5 out of 10 on that severity level as they're escalating, right? And we can stave it off. We prevent the crisis with the right level of kind of gentle course correction. And then, the 5% or so of all these interactions that we do need to bring back to the clinic, right, back to the treating oncologist, we've reduced all the noise. So the signal gets through and they can help respond faster. So like I said, collectively, the resolution time now becomes 30 to 60 minutes instead of 1 to 2 days. So I think that's one of the biggest gaps that we're able to fill.
Yeah, that's awesome. And just the fact alone that Remy can now handle 50% of those inbound immediately. And then just a clarification on the other 50% or maybe 45%, that care team is still trained, like their APPs and RNs and those sorts of folks on that side who are trained in kind of oncology and standard of care for that health system or whatever that is. Is that kind of how it works?
That's exactly right. So those are our team members, all US based. They're all oncology trained MAs. Oncology trained RNs. Our RN team has an average of 20 years of in-clinic oncology experience. So cool. Very steeped in oncology specific, which is important for this line of care. You can't just have a generalist. You can't have a new grad. It's to support this patient population, it's really important to have that right level of care. And then also, as you mentioned, we do have APPs as well. So we have our kind of internal escalation pathways where Remy is able to kind of know the acuity, determine that, and then connect it right to one of those levels of care right away. And then again, that's what helps us get to those faster resolutions. Think about a traditional case, like, you leave the voicemail, and then they got to go check in the chart and do all this stuff. And they eventually call back and they do some triage and they're like, okay, we'll have a nurse practitioner call you during their next break, which could be, hours later. We kind of shrink all of that down.
Yeah, that's awesome. And would love for you to dive, just as somebody who's not, necessarily like a software engineer, tech savvy, or those sorts of things. Can you talk about, your tech stack? Like, how was Remy developed? Is he like, is it a he or a she? Or I guess it doesn't matter necessarily, but
yeah, it's funny. It was originally meant to be gender neutral. So Remy is a name that actually, if you're in France, Remy is more, commonly known with being male. The US, you'd probably default to thinking female, but that was the original premise. Just playing off the Reimagine Care first couple letters. So that was Remy.
Oh, cool. Yeah, that's awesome.
We have started to now bring a little bit more of a persona. So here in the US, it is, female based. And so we have some imagery we're working on right now. But yeah, so tech stack behind it, as you mentioned, we did just have the announcement earlier this year about the whole new version of Remy, the kind of a ground up, rebuild because the technology has changed so much. And I feel like it's changing, like it's doubling how fast it's changing now every single day. If not every hour. And so we kind of went back and just built it up from the ground to really take advantage of all the new platforms, all the new technology. And the exciting part about Remy, we say Remy, but really it's a whole platform. And there's actually multiple agents that we have at work. There, we have an enrollment agent. So there's one specifically trained as patients are initially getting enrolled, the questions they ask, which provider are they partnered with, and so the nuances that go with that. And so there's an agent that is working through that. Then Remy is the one that does all like the support, the triage, initial questions. We also have a evaluation engine that's constantly running in the background. 100% of every patient interaction is fully monitored with the automation agent that we have. And then, we're able to kind of tweak, which percent of those then gets bubbled up to the care team for, monitoring and QA after the fact. So it's like a whole family of agents all working together in concert. And because of the way we built it, we can actually tap into any LLM on the back end, which is really exciting. So we can navigate between, Anthropic and OpenAI and all the other ones. We tend to have a couple that we hone in on more, but we didn't build our own LLM, for instance. We decided early on to invest in the prompt engineering and the context engineering.
Okay. Yeah.
Which I think it was a brilliant idea, and I cannot take credit. Our team is amazing, so I'm going to give all the credit to Scott and Emerald and the team for how they've built it. But that was really a thoughtful perspective. Is like, how do we not be tied to a specific LLM, but allow us that flexibility? And so that's where the team really learned a lot on the context side last year and built it, and now we're live with it. So.
Yeah, that's awesome. And then I'm just curious, there's a ton of data flowing through those conversations. So are you able to, is there like a data play here where it's like, hey, the model or Remy gets smarter over time as they're engaging with more patients? De-identified, I would, of course, assume. And then you can say, hey, this patient was diagnosed with this cancer, had these things happen. Like, is that kind of a potential angle, not angle, but like, better data, better information for future patients?
Absolutely. So there are multiple, I'll say, data plays. I like that. That's a good word. Where we have a really unique data set, Blake, right? So think about like right now, there's that gap, right? Okay, so we got all the historical information about patients, diagnosis, treatment plans, all the demographics, et cetera. But then what we lack is like really connecting the dots into what happens between the visits. That's what we excel in, right? Because we can now normalize and say like, so everyone with triple negative breast cancer, that was on this specific therapy, I can normalize them to day 0 of their treatment beginning, and I can now track and show all of the questions and symptoms they have at each leg in their journey. That's a really interesting data set for pharma specifically, down the road. But we're not doing it yet. We, obviously it would certainly be de-identified if we ever go that path. That's a future growth horizon. But for us, what it's doing, and this is the exciting part, is it's allowing us to build more personalized outreach. So one of the things that we've had in the earliest versions of Remy that's been live for the couple of years before the new one we just launched, it was a bit more, let's say, it was programmatic, right? So, we'd reach out on a set day with like just kind of the symptom check-ins. We'd reach out on a set day with the E-pros. And although it was received well, we always knew there's an opportunity to be more personalized, right? So now if, we're actively building this with a new version now that it's launched, is a lot more of a personalized approach. So if I know your diagnosis, I know the treatment you're on, and I know most likely 3 days after your second infusion, you're going to have this happen, then I can proactively send you a message.
The predictability. Yeah.
Educate you and like, hey, don't be worried if you start to feel this in the next 24 hours. Here's how you can like head it off, or here's how, let us know if it goes to this. So that education, I think, will become invaluable for that personalized approach. And then you end up with this whole kind of orchestration layer in the care instead of just hey, we're pinging you a couple times a week, and then we're here whenever you send a response back. We've delivered amazing outcomes on that. Just imagine how it's going to be when we get into this personalized approach.
That's awesome.
Dan and Blake, this is where I think that's such a perfect example of why we got excited about version 1 and 2 of this business model, because you can't go into a hospital system selling that. You don't have any differentiated approach or data to be able to do it. But now they've learned from actually implementing this into some of the largest cancer centers in the country. How do we now take everything we've learned? I mean, it could become the stickiest business model, because why would you, as it continues to learn and get better and prove more attributable ROI, which is, and write about Blake quite heavily. That's one of the hardest things for a lot of these startups to do right now. There's just the barrier to replace what Reimagine Care has done, I think, becomes very hard.
I can imagine, yeah, especially talked a lot about like orchestration, and that, closed loop funnel becomes even more powerful over time for a health system. And I imagine on the health system side, or, community oncology side, well, actually, Dan, would love to pose this question to you. Does your model differ between the two kind of customer bases? Because obviously there's a ton of activity happening on both sides, but I'm curious for your perspective on how you see that shifting.
Yeah, it's a very good question. So our model doesn't shift, at least not right now, but there ends up being a little bit of a different value to those different stakeholders. Right. So community oncology is going to have things that are a little bit more important to them, especially if you get into more of the rural. But they might just have a hard time staffing their team. And so this might be just a really big opportunity to help handle like a staffing issue they have, right? Whereas the larger, more comprehensive cancer centers, this might be more of an innovative opportunity to bring technology to their patients and fill the gaps as well. Thinking about the longer term data opportunity. Then you, within each of those buckets, now you slice it and say, all right, well, for those that are in just a fee for service world, we're actually able to help increase new patient volume because we free up their team, to be focused on the higher acuity patients. We free up the clinic time, that they would previously have to hold for, unannounced visits. And now they can see more patients. And we've proven a 9 to 10% increase in new patient volume in the first year. So if you're in a fee for service world, that's really exciting for you. If you're on a value-based care side, we've actually proven a 67% reduction in ED visits, right? Which obviously we know is amazing for the patient experience, but some health systems, if you're not in value-based care, whether they admit it or not, they're going to think of their ED as a revenue center, unfortunately. And so, but if you're in a value-based care, that's totally different. That 67% reduction becomes meaningful to your bottom line. And so, again, within each of those kind of patient segments, or I'm sorry, each of those client segments, you do have the nuances of what value they would see in a program like this.
So I'd love to dive into that distinction real quick, just because really fee-for-service versus value-based care today seems mostly like a financing difference, like how are you reimbursed for the most part, right? So whether you're working with somebody who cares mostly about, is in a fee-for-service heavy world versus value-based care, does Reimagine Care from a model perspective surface different things, or are you just kind of like, it's the same no matter what they care about?
It is. It's the same because we've built this on oncology standards, right? The triage that's built into Remy, it's built on, it's been adapted into the technology and really kind of made our own version. But it started with oncology standard, right? ONS and NCCN standards that we've then adapted, into a technology kind of forefront here. But we've built a program that is really around the patients and delivering the best possible experience and support for them. And so on the back end, I'm not going to do something differently for someone if they're fee for service versus value-based care. We drive value in both of those buckets. And so because of that, I don't have to change the program. I think that's the important distinction for us.
I'm curious, because I've written about vertical integration kind of in oncology, and it seems like the main buyers of physicians, at least on the specialty side, are these drug distributor companies, right? The Syncoras and so forth of the world. I would imagine you work with them through an MSO or physician partner at some level. Curious how you think about like the sustainability of that model, I guess. This is more like a high level question, especially because it seems like their incentive is to lock in those drug distribution margins, right? And so if I think about that from an economic perspective, they want the highest cost, drugs running through the system. And maybe that's the best for the patient, but maybe it isn't. But I'm curious how you think about that from just an existential accessibility to cancer care perspective.
Yeah.
Sorry, that's kind of a loaded question. I apologize.
It is a bit of a loaded one. It kind of goes back to like how much time you got. I would say there is a lot of opportunity in healthcare to rethink and align incentives. I think to your point, like we have some misaligned incentives, especially in cancer care, right? And that's where, I go back to my earlier like point when the company first started, before I joined, the company first started, we were thinking about trying to bring treatment into the home. There are too many hurdles because providers are like, well, that's actually my revenue source, right? The drug is my revenue source. And now you're going to take that away and move that into the home. Like it becomes like, again, it goes back to the point of misaligned incentives. And so there are opportunities. And I think the value-based care wave that I feel like we're all kind of still riding here to some extent, like was an attempt to start to align some of those, but it needs to be more, right? We need to continue to really rethink and get to the point where we're all on behalf of better outcomes, and not just like what has kind of been deemed value-based care at the moment, but like how do we ensure that all the big players, right, from pharma and the payers and the providers and all the startups and that whole ecosystem of how we're helping to support all of these entities, how will we end up with the right aligned incentives so that we can all go and say like, not have to worry about someone making a decision just because like, yeah, well, okay, I get a 80% margin on this drug versus a 20% on that one. So I'm going to go with, drug A. Like that's where we need to get to, Blake. And so, yeah, it's a really important question, but I think it's even bigger than just the oncology landscape. I think it just gets magnified in oncology because the drugs are so expensive.
Ben, curious if you have any thoughts kind of as more investor holistic viewpoint. If not, no worries.
Is there anything in particular that you think would be helpful for me to double down on? I think Dan.
I think because you're mostly you're not on the therapeutic side, but maybe that this vertical integration presents certain opportunities, to work with these players who are trying to bolt on and glue together all of these things. Are there certain areas you think about investing in or where Reimagine could push into based on kind of the emerging dynamics of that M&A?
Yeah, I mean, and I've talked with Dan about this point too. I think Reimagine Care has been great about knowing where they are exceptional and best in class, which is helping manage patients outside the four walls of the hospital. And then an opportunity where, okay, if you become that trusted party to manage that part of the care continuum, there's a huge opportunity Health System X doesn't want to keep contracting with a whole new host of providers. They're looking for trusted partners, and you could think about that as distribution in any way and tech in any way. So I think huge opportunity to consolidate that. And I actually think your question too, Blake, was so smart on is it different for community versus academic versus health system? Because I really do think it is. I mean, we have certain companies that have different go-to-market strategies depending on the buyer at these different groups. So if you're going through the CIO, that's different from the CMO, et cetera. And I think that's just a lot of market education, and making sure you're spending the first few minutes of each conversation asking them what their priorities are. But at the end of the day, it's this continuous loop of point solutions versus point solution fatigue that I think Reimagine Care is better positioned than most actually to help take advantage of.
And to clarify, because Reimagine sits across the entire oncology service line for a health system and orchestrates that platform.
Yeah, and also like what Dan was saying earlier about use whatever LLM you want to use. Like we're good. We will, whoever you are working with, we will help you manage that. And on the other side, if you want help and guidance for what are your priorities and we can help you figure out what those priorities are, come to us for that too. So I think it's that true. There are very few companies that are true partners to their systems. And I think that's one of the big differentiators.
And I'll jump in here because one of the things that Ben and I, we like to grab a whiteboard and just kind of work through some of this stuff. And, I remember our first conversation in his office, it was kind of coin this black box opportunity here. There's think about this, right? Within a given practice, they do have they're approached 10, 20 times a day by groups that are trying to sell to them. And so if we can help to simplify that, and again, like Ben mentioned, because of kind of the part that we currently own, but then also we almost have, well, we do have the opportunity to be this orchestration layer. And so we connect back a lot of times, and right now it's a little bit manual, but like we are able to connect patients back to all the additional services that a practice will have. So, whether it be like behavioral health, for instance, or financial support, or transportation, like because we are talking with them through Remy and then through our care team, we're actually able to really understand what their needs are way more than you can suss out in a 15-minute clinic visit every week. And so that allows us to then really connect back and say, oh, because you're receiving this treatment through Moffitt, did you know you have access to this? And then we connect them. We do warm handoffs in that case. And so
Cool.
now thinking about this orchestration layer at a bigger level, because a lot of these practices are partnering with other groups to fill some of these things: behavioral health, transportation, financial support, all these other things. And so if we're able to then be this orchestration layer and connecting in real time, or Remy can like sense from a conversation that they've got, they're worried about being able to make their treatment because they don't have a caregiver support or they don't have transportation. We can connect them in real time to the other service that we know that Moffitt or Memorial Hermann may have. And so that's where we're kind of closing the loop. So then we can become like that point solution, and not necessarily meaning we're going to go build it all. There's a lot of great groups we could partner with to fill those gaps, and then kind of be a bit more of one initial point with the provider, but then allowing a whole bunch of suite of services in the back end.
I love that. And back to our discussion around fee for service versus value-based care, I feel like, and you guys, I would love y'all's perspective on this as well. It seems like we're at this point, especially with AI and technology, where it's not one or the other. It's just, we're like kind of converging into this like high value care situation where like, hey, these tools, this navigation, this ability to connect patients within the ecosystem or between visits, that's what we care about, whether we're in one or the other, and both of them keep that product keeps the patient within our network, and we know where they are, and we have data to support them. Is that kind of fair to say? Would you agree with that statement?
Yeah, absolutely. There's one of the, I'd say, value props that we talk with systems about is leakage. Right. I mean, there's a stat that came out recently. 59% of all patients would leave their existing provider if they were provided a broken communication experience. And so think about that, right? They'll go across the street if they have an option. They will go across the street if they're not able to communicate with their provider and get answers in a way that is where they want to be met, whether that's text, whether that's email, whether that's the portal or whatever. So if they have provided a broken experience, then yeah, they're going to leave. And so that leakage is real. And that's one of the things we do talk about with our providers is like extremely high patient satisfaction, right? 9 out of 10, on average or higher. And so that allows us to kind of help say, well, we're able to keep your patients here because we are the glue in between all those visits. So they're not going to leave, because they're getting a better experience than they would across the street.
And also, economics aside, obviously leakage is important from an economic standpoint, but I think about the patient themselves, and even more so on oncology. And Ben, maybe you can speak to that too. But if I had cancer, I would be terrified, and I want to have as much information as possible and know what's going on. And to the fact that your satisfaction scores are high seems to signal that it's better than what it was before, at the very least, right? And trust is increasingly, like the human side of this is increasingly important as technology figures out the other stuff. So that's pretty cool.
Yeah, I mean, even when you're doing second opinions, I mean, I think there's something to be said for, yes, let's leverage tech to help you get the most effective second opinion. But I wanted to hear from the other oncologists that had treated thousands of cases like mine, not just, some form of an algorithm. So I do believe in the human in the loop part of this pretty wholeheartedly.
Yeah, yeah, absolutely. Tech enabled, not tech replacing, right? I Also, back to y'all's point about whiteboarding sessions. That sounds awesome. I bet there's a lot of people who would pay money to listen in on those. So I'm sure you guys have had some eureka moments. But you guys have mentioned a couple times the, so much of care, and this is a theme in across healthcare in general. So much of care is moving outside of the four walls of the hospital, and so it creates opportunities and need for things like Reimagine Care to enable new processes. Dan, curious for your perspective, um, as you're having conversations with both the community oncologists, the group versus the health system. How much more is that ambulatory strategy like key to their growth strategy than it was maybe 2 or 3 years ago?
Yeah, I mean, I think it's definitely important. You have to meet the patients where they're at, right, and where they want to be met. And so I think Moffitt's a great example, right? They've got their massive campus, but then they have these Moffitt ambulatory centers, like they're located around in the region to help offer easier access for patients that might be coming from further away, and being able to connect with them. And so that longitudinal journey, whether it's you know, being there for those initial treatment planning visits, or the actual treatments themselves, or the virtual support in between, like, you have to have a thoughtful approach to it, right? You have to be able to meet the patients where they're at and where they want to be met. Some want a text, some only want a phone call, right? Some want to be in person, some want to be remote as much as possible. And so really kind of taking that personal preference into account, but then being able to have all those avenues, all those channels. So, if they do need to go in for something quickly, they don't have to go, maybe they're more rural in Florida and they don't have to go to all the way into Tampa, like downtown Tampa, to go to the, Magnolia campus. They can just go to one of their local Moffitt ambulatory centers that's, 5 minutes across the street there. So that's, I think, the strategy that I think a lot of these systems and practices are really figuring out now. And it comes back to just understanding the patients, and that you can't just build one channel. You can't build one avenue and expect everyone to fit into it. It's not going to work.
Yeah, that's fascinating. I appreciate that answer. What about, we're kind of nearing the end of our conversation here. I'm curious, how would you assess, the current state of Reimagine Care, and where are you guys looking to build into? What's your customer base saying, like, hey, we need this, or how do you kind of think about growth in the next 3 to 5 years?
I appreciate that question. Like, this is actually what I'm really excited for, like what we're doing now, and where we're moving into. And I'll be honest, I didn't come to Reimagine Care 3 years ago to just do symptom management and build a nice little like healthy company. Like, it's the next phase that I'm really, really excited for. And so, a lot of the oncology space is now moving towards cell and gene therapies, bispecifics, but also specifically moving them into the outpatient setting. So predominantly, CAR T cell therapy was done inpatient. You'd had to have patients monitored in the hospital for up to 2 months, which is a very costly endeavor. And so for the last handful of years, the stats are like 18 to 20% of patients that could have benefited from these life-saving therapies were not getting them, right? Or 18, 20% were, the remaining were not, because it's only done at like, very small number of fact accredited locations across the country. And so if you were, not near one of them or didn't know about one of them, then you're just kind of out of luck. Now, with the REMS changes last June, now there's a really big move. The entire oncology landscape is moving towards outpatient programs. So if you didn't already have one, you're looking to build one. If you had one before, or you had the inpatient one, now you're going to look to moving it to outpatient, and how do you expand it? And so now think about this, right? Very like high intense treatments, right? That are, with real serious side effects and impacts, ICANS and CRS, like neurological like impact from these therapies. But they have proven to be almost like life-saving, right? In some cases, like some people are in full remission after going through, the CAR T therapies now. And so, but the impacts are real. So way more than just standard chemotherapy. And so now we want to provide our infusion, and then we're going to send them home instead of having them in a hospital for 2 months. Well, you got to be really careful monitoring them with, vitals, being able to be there within seconds. And so that's exactly what Remy was built for. And so we're actively building programs that help support these, the cell therapies and the bispecifics in the outpatient setting as the next horizon for Remy. So, we'll kind of have this crawl, walk, run approach. Crawl is start with symptom management. We've proven outcomes, tens of thousands of patients. We've already got that. Like we'll get you up and running with that. And then run, or crawl, walk. I guess the next one would be walking, right? Where you layer in some RPM devices for certain patient populations, allow them to build some codes and recoup some revenue on that, like supporting some of those patients. And then the next one would be the full, what we're calling advanced therapy management. So that's the outpatient cell therapies, bispecifics, where you layer in all of that together. And we're able to help be that kind of easy button for these practices and these health systems that want to build these programs, right? We can take the entire patient education, patient management, monitoring, and support, take all that off their plate so that they can focus on the 100 other things they have to do to go build these types of programs, right? Because there's a lot that goes into this. So if we can become that easy button solution, that's what Remy was really built for, is being that kind of connectivity, glue between. So I'm really excited for these and the opportunity to bring more of these life-changing therapies into the community and into the patients that can benefit from it. So that's like one of the next big horizons for us that I think is going to be mind-blowing in the impact we can all have together. But also, Blake, I think we're at the early stages of some consolidation. There was a lot of companies that were, started in that the COVID times that are, starting to figure out, proving the outcomes. We're getting the cream is rising to the top. But I think going back to our conversation earlier about the point solution fatigue and starting to like maybe figure out the right ways for some of these groups to be combining forces and go like tackle the market together. I think we're at the beginning stages of a 3-year journey where there's going to be some really impressive M&A that's going to help some people really rise to the top and be the winners. And I think the ones that aren't a part of that, I think they're going to struggle. And so those are kind of two, when you think about like what I'm excited about and what I see in the horizon, those are two things that come to mind. So
Makes a lot of sense. And I'm curious, this is too commercially sensitive. Feel free you don't need to respond, but are there areas where you are looking to bolt on certain, adjacencies or competencies that you don't have today, or partnership, or what does that kind of look like?
Yeah, we're always exploring partnerships. Some of them just happen organically. So right now we're focused on just treatment. And we've not built a survivorship platform. And so is there an opportunity just to partner with some groups that have already done it? In Oncology Ventures, there's a group that does just that. And so instead of us going to build that, would we just pass that off and have like a seamless transition? Likewise, the upfront earlier diagnosis, second opinions that then could feed into the treatment. The behavioral health that kind of spans the entire journey. That's not a core competency of ours. And so there's some really great players out there. How do we kind of think about, partnering with them? So that way there you can help be more things to the patient and to the provider without having to be point solutions, to death. And so, yes, there's actively things we're always exploring that landscape. And so speaking of whiteboarding sessions, Scott, our Chief Product Officer, and I love to grab a whiteboard when we're in the same city and try and, kind of plan out what that might look like, here in the immediate term. And then also what are those opportunities as we, all continue to grow.
Absolutely. And it makes sense to your point around consolidation of the digital health side. It makes sense given what we've seen on the, hospital and community side as those groups consolidate, and also point solution fatigue and AI. It makes sense that there would be some platformization and partnerships and greater core competencies. Then maybe last healthcare question is for you, posing you a similar question based on Dan's comments and potential for partnerships in the future and those sorts of things. Where do you see kind of the investment side of this going, and kind of just from an oncology perspective?
So this is where I think the biggest difference and update between our fund two is looking for more unique business models. And so I think there is only so much of a budget that a lot of these cancer centers and the hospital systems will have to continue to deploy to data-driven care delivery services, back-end tools, et cetera. So we're looking for opportunities. We made an investment into a company selling into the life insurance space, helping engage folks earlier in the journey, assess their genetic risk, help match to personalized therapies, and hopefully get that number of personalized therapies up in the market. But keeps your for the life insurance side, keeps your members on paying their monthly premiums for longer and reduces the main payout. And so, how do we find different buyers in the ecosystem, all with the end goal of improving care, reducing costs? I think that's a huge opportunity too. Is we're seeing new startups actually deliver some of that care. So we invested into a company called NextCure in partnership with RA Capital and Syncora to actually improve the delivery of CAR-T. And so huge opportunity, I think, for Reimagine Care as a potential partnership as well. But they're setting up JVs with larger systems. Some of that will become public soon. But how do you leverage all of that data learning to actually deliver some of that care? I think is really interesting. And then there's new coding opportunities. So you have PIN codes that came out maybe in the last 2 years, which is just unlocks a whole other reimbursement opportunity area for people that are hiring nurses and care navigators too. So I think there will be more of that. And then it's just going to get more competitive. Like if you aren't with your platform in real time, showing people that you are saving them money and improving, whether it's NPS of patients, providers, etc., people aren't just sticking onto those contracts anymore. So I think hopefully the best tools and tech will win there, and at the same time knowing it's a distribution game, right? So that's why it was one of the things that attracted us to Reimagine Care is just the amount of different partners. Yes, continue to go deep in the ones you're already working with, but if you're in with community to academic to health systems across the country, you're in a pretty good spot.
I love that. Yeah, that sounds great. And you know, oncology is such an important space. Wishing both of you guys nothing but the best, nothing but success as you guys continue to grow and help patients across the country. So that's fantastic. Got one more personal question for you guys, and it's something I pose to everybody who comes on to the Hospitalogy podcast. And it is, what is one experience, piece of advice, book, or other content you've consumed that has fundamentally changed how you live your life? And maybe Dan, we start with you.
All right, I like it. Let's say the piece of advice I received early on in my career was to just say yes. I think just try new opportunities, try new adventures, both in your personal life but also in your career, right? So if you're young in your career and you're trying to make a name for yourself, and someone says like, "Hey, we need someone to do this," or "Would you want to do that?" or "Want to go build that?" Just say yes, right? Say yes, because I think that is how I ended up finding myself in a startup, early on, and just have loved it ever since. So I think that's a one that really resonates with me. And then I'll do a quick book one too. It's Never Eat Alone, which I think is just a really good one. It's a very thoughtful way of networking. I'm not like the world's best networker of any way, but it's like there's a way to network properly, not just in a cheesy kind of traditional used car salesman kind of way. And it was a really thoughtful way of like, how do you think about that, building meaningful relationships, not just networking. So that was a book that I've enjoyed and I read years ago and refer back to.
That's awesome. So, all right, everybody who's listening, Dan is a yes man. So I'm just messing with you. That's awesome. I appreciate it. All right, Ben, go for it.
Well, my other version of Dan's advice, I think, is the worst someone could say is no. Like the amount of people that we have reached out to that I was like, there is no shot that they are interested. They get so many emails. Sometimes that's right, but also it's just a person, right? Like you can catch someone on the right day, wrong day. But just putting yourself out there in those situations and knowing that you'll sometimes get no's, you sometimes won't get an answer, you get ghosted, um, whatever else. But yeah, I think a lot of people take a lot of it too seriously, and are worried about egos getting bruised, etc. So that's my other side of the Dan's yes one. In terms of book for work, The Power of Moments by Chip and Dan Heath, I thought was really, really well done. And it's something, it was why I came up with the comedy part of our newsletter, was people get enough newsletters from enough different people. What if there was a little something? Like, what if there was just something that is only 15 to 20 seconds that will hopefully make someone laugh or bring something a little bit different to the day? You could find that in so many different other parts of your process. I mean, what I do with Dan and Reimagine Care and what we do with all of our portfolio companies is as soon as we invest, we block off an hour and a half and we do a session on here are our partners, here's where we think we could help, and just, making that interesting, fun, and not just a reporting one way, but a real collaborative relationship. We do in-person events that are a little bit unique and funky. We're having at our annual LP event this year, we're going to have a stand-up comedy portion of it. And so just bringing a little bit of something to your day-to-day, it's what the book was about. And you could find that in potentially very boring things too.
Yeah, I feel like a lot of the time healthcare can be very serious and we can have a lot of conversations about very negative things. But I like that you're injecting some comedic relief, and also just both of you guys are looking at it through a very optimistic lens and, where are the opportunities. So thank you guys both so much for the conversation today. Learned a lot about Reimagine Care and Oncology Ventures and, where you guys are thinking about and the opportunities and the excitement. So best of luck to both of you guys throughout the rest of the year. And I'm sure we'll be in touch soon. Thanks for coming on.
Thanks, Blake. Appreciate it.
Thanks, Blake.